Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to the brand new series of our channel, the comprehensive Medicopearls. In this series, we will discuss some of the important topics of medical sciences in detail. Stay tuned every Saturday 8 p.m. Pakistan Standard Time and 3 p.m. GMT. Episode 1, Eyeball. In this, we will cover following topics: muscles of the eyeball, axis of the eyeball, and features of the nerve lesions. But before starting, to stay up to date with our latest videos, make sure to subscribe to this YouTube channel by clicking the red button, and don't forget to press the bell icon. Let's begin. First of all, we will discuss muscles of the eyeball. We have divided these muscles into two categories. One is the intraocular, the other one is the extraocular. Intraocular muscles are the muscles within the eyeball, 3 in number, and these muscles are the involuntary. Extraocular muscles are the muscles outside the eyeball, and these muscles are the voluntary muscles, and these are 7 in number. Intraocular muscles are the involuntary muscles, and we cannot control the activity of these muscles. We have two kinds of intraocular muscle, the pupillary and the ciliary. The pupillary muscles are 2 in number. One is the pupillary dilator, the other one is the pupillary constrictor. Pupillary dilator have alpha-1 receptor, which is activated by epinephrine or norepinephrine released during sympathetic activity, and it causes the mydriasis. Mydriasis means pupillary dilator will contract to dilate the pupil, and this is called as the mydriasis. And the other one is the pupillary constrictor. Pupillary constrictor has the muscarinic receptors, which are activated by acetylcholine released during parasympathetic activity. The third intraocular muscle is the ciliary body, which has muscarinic receptor and which is activated by acetylcholine as well. Ciliary body will contract to decrease the diameter of lens, and parasympathetic fibers for pupillary constrictor and ciliary body are carried by third cranial nerve, and it causes the meiosis. The pupil will constrict. Pupillary constrictor and ciliary body are required for accommodation for near vision. In accommodation for near vision, we require two things. One, pupil should be constricted and diameter of lens should be decreased. Let's move on to the extraocular muscles. Extraocular muscles are the voluntary muscles, and we can control the activities of these muscles. We have divided these muscles into 3 groups based on the nerve innervation. The third cranial nerve will innervate these 5 muscles: the superior rectus, inferior rectus, medial rectus, inferior oblique, and levator palpebrae superioris. Fourth cranial nerve will innervate the superior oblique, and sixth cranial nerve will innervate the lateral rectus. We have the mnemonic for it. SO4 means superior oblique is innervated by fourth cranial nerve, and LR6, that lateral rectus, is innervated by sixth cranial nerve. So let's move to the next topic, which is axis of the eyeball. But before starting this algorithm, we should understand the axis of rotation. We have 3 axes of rotation. One is the y-axis, the vertical one. The other one is the x-axis, the horizontal, the transverse one, and the third one is the z-axis, which is the anterior posterior one in our discussion. So now we will discuss this algorithm. So on the anterior posterior axis, the eyeball can have 2 rotations. One is called as the extorsion, the other one is the intorsion. Extorsion means 12 o'clock position of eyeball will move towards temple, or means away from nose, and the second rotation is the intorsion. Intorsion means 12 o'clock position of eyeball will move towards nose. So this is the axis which we are discussing, the anterior posterior, and on this axis eyeball can rotate either way. Either it can move towards the nose or it can move away from the nose. If it is moving towards the nose, it will be intorsion, and if it is moving away from the nose, it will be extorsion. So this is the axis which we are discussing. So the second axis is the vertical axis, and on vertical axis we can have 2 types of rotations. One is the abduction and the second one is the adduction. Adduction is the movement towards the midline of the body, and abduction is movement away from the midline of the body. And in this rotations of the eyeball, we will consider abduction as the pupil will move away from nose, and in adduction pupil will move towards nose, because nose we can consider it as midline of the body as well. So this is the axis which we are discussing, vertical, the y-axis. If some axis is extending from our head to toe, and here is the eyeball, and it has to rotate. It can rotate either way. It can rotate towards nose, or it can rotate away from nose or towards the temple. If it is moving towards the nose, it will be the adduction, and if it is moving away from the nose, it will be abduction. Now we will discuss the transverse axis. Around the transverse axis we will have two movements, upward movement and downward movement. This is the transverse axis. So either the eyeball will move upward or it will move downward. It is the simple term, upward movement or downward movement of the eyeball. Here the important point is that do not mix extorsion, intorsion with abduction or adduction, because in extorsion, intorsion, the 12 o'clock position of eyeball will move away from nose or towards nose, whereas in abduction or adduction, the pupil will move away from nose or towards nose. Just consider the difference of the axis, anterior-posterior axis, and this is the vertical axis. And one significant point about the axis of the eyeball is that if all three axes of both eyeballs are in line, one object will make only one image. But if any axis of the eyeballs are not in line, then a person will see two images, which is called diplopia. Now we will discuss the functions of the extraocular muscles. Medial rectus will help us in adduction or convergence. Adduction means pupil will move towards nose. Lateral rectus will help us in abduction or divergence, which means pupil will move away from the nose. Levator palpebrae superioris, its function is a bit easy to remember, that it will help us in elevating the upper eyelid. And to understand the functions of superior rectus, superior oblique, inferior oblique, we have to look at this diagram. This is the right eyeball, this is the left eyeball, and nose in the middle. Now look at the right eyeball. We have mentioned the names of the muscles in accordance with the direction of the movements of the eyeball they cause. The superior rectus, inferior oblique, lateral rectus, superior oblique, inferior rectus, and medial rectus. We have already discussed the function of medial rectus and lateral rectus. The medial rectus will cause adduction or convergence. Like you can see, this is moving the eyeball towards the nose, and this is the only function of this muscle here. And the other one is the lateral rectus, so you can see it will cause the abduction or divergence. Let's see, and it is moving the eyeball away from the nose. This is the nose, our reference point. It is lateral rectus is moving the eyeball away from the nose. So these two muscles are easily understandable. So now we'll discuss the functions of the superior rectus, inferior oblique, and superior oblique. But keep in mind one important concept, that while looking at distant objects, these four muscles will have three functions along three axes. But when eyeball is abducted or adducted, these four muscles will only have one function. So when looking at a distant object, superior rectus will have three functions along three axes. You can understand here the knowledge of axis again as well. Superior rectus will cause upward movement along transverse axis, will cause adduction along vertical axis, will cause intorsion because it is moving towards the nose, will cause intorsion along the anterior posterior axis. Inferior rectus will cause extorsion along the anterior posterior axis. Inferior rectus will cause adduction along the vertical axis and will cause the downward movement along the horizontal axis. Superior oblique will cause intorsion along the anterior posterior axis, will cause abduction along the vertical axis, and will cause the downward movement of the eyeball along the horizontal axis. And inferior oblique will cause the upward movement around the transverse axis, will cause the abduction around the vertical axis, and will cause extorsion. Here again the eyeball is moving away from the nose and will cause extorsion along the anterior posterior axis. So just to summarize the functions of these four muscles when looking at distant object, we just have to make a addition vector of these three vectors. Okay, so for the superior rectus, the addition vector will be in this direction, and this is the upward medial direction. So we can say that superior rectus is responsible for the upward medial movement of the eyeball. In this way, inferior rectus is responsible for the downward medial movement of the eyeball, and inferior oblique is responsible for the upward lateral movement of the eyeball, and this is the superior oblique, and its addition vector will be in this direction, and it will be responsible for the downward lateral movement of the eyeball, because we are considering an addition vector which is usually in between the two vectors. Now we will understand the functions of these four muscles when eyeball is abducted or adducted. Keep in mind that during abduction or adduction of the eyeball, these four muscles will have only one function. So this is the best position to assess the functionality of these four muscles. And here is a trick to memorize the functions of these four muscles when eyeball is abducted or adducted. You have to modify this picture. You have to swipe SR with IO, means superior rectus will be swiped by inferior oblique, and superior oblique will be swiped by inferior rectus. Okay, so when eyeball is abducted, upward lateral movement will be caused by superior rectus, and inferior rectus will be responsible for the downward lateral movement. And when eyeball is adducted, upward medial movement will be caused by inferior oblique, and downward medial movement will be caused by superior oblique. So just keep it very simple and easy. Memorize this diagram and understand the functions of these four muscles when looking at distant object. And to understand the functions of these four muscles when eyeball is abducted or adducted, just switch SR with IO and IR with SO. So let's move to the very last topic of today's discussion, which is the features of nerve lesion. Features of third cranial nerve lesion: we have a mnemonic PMDC, easy to remember. P means ptosis, drooping of the eyelid. Mydriasis means dilatation of the pupil, and D is the downward lateral gaze, and C is the cycloplegia, means loss of accommodation. So now we can understand these features from the algorithm we discussed earlier. Yeah, this one. So the third cranial nerve is innervating these muscles. Levator palpebrae superioris will be paralyzed if third cranial nerve has some lesion, and its function will be lost, which was to elevate the upper eyelid, and it will result in ptosis. And the third cranial nerve is also carrying the parasympathetic fibers for pupillary constrictor and ciliary body, and their function will be lost. No accommodation for near vision, which will cause the cycloplegia, means no accommodation for near vision, and the meiosis will not be occurring there because the pupil will not constrict. So the result will be mydriasis. And the fourth feature, the downward lateral gaze, is because of the paralysis of these four muscles. We can understand this from this diagram. So the superior rectus is paralyzed, the inferior rectus is paralyzed, the medial rectus is paralyzed, the inferior oblique is paralyzed. So you can understand that these four muscles, if paralyzed, these directions of the movements of the eyeball are lost. So the only direction in which the eyeball can move is the downward and lateral, because the lateral rectus and the superior oblique are functioning normally. So these two muscles will move eyeball in the downward lateral direction, causing the downward lateral. So now look at the features of the fourth cranial nerve lesion. These are the diplopia will improve on tilting the head towards normal eye, diplopia will improve on climbing upstairs, and diplopia will worsen on reading. We can understand this from this picture because these are because of the lesion in fourth cranial nerve, and fourth cranial nerve is only innervating SO4. SO4 means superior oblique, only SO means superior oblique is paralyzed. So these directions of the movements will be lost, and the rest of the muscles will be functioning properly, and these will pull the eyeball in upward medial direction, so this diplopia will improve on tilting the head towards normal eye. This is the clear cut clinical feature of fourth cranial nerve injury. Now look at the feature of the sixth cranial nerve lesion, that is adduction or medial rotation of the affected eyeball. We can understand from this diagram, because the sixth cranial nerve is only innervating lateral rectus LR6, so this muscle is paralyzed, but rest of the muscles are functioning normally. So the rest of the muscles will pull eyeball in the direction of the nose, so it is called the adduction or medial rotation of affected eyeball. Hope you understand this topic now very well, and here is the question for you, and please give us your feedback in the comments. Thank you. Allah Hafiz.
Please like and share this video, subscribe to our channel and press the bell icon for more interesting videos. Thank you.